What if I told you that one of the best things you can do for your heart after the age of 70 is to politely refuse to let a doctor test it? That sounds like madness, doesn't it? It goes against every piece of advice we've ever been given. We are taught that the heart is a fragile machine, a ticking clock that must be constantly monitored, wound, and corrected. We see it as the epicenter of our physical life, and so the idea of checking on it seems like the most responsible thing in the world. But I have learned, from the quiet teachings of ancient texts and the simpler, harsher teachings of modern life, that our responsibility in the autumn of our years looks very different. Sometimes, the most responsible act is one of stillness. Sometimes, the most life-affirming choice is to decline the test. Let's talk about the cardiac stress test. It has a compelling logic. Push the heart and see if it fails. We put a car engine through a stress test. Why not our own? But a heart is not an engine, and a human being is not a machine. As we age, our bodies change in ways that are natural and necessary. Our arteries, like the branches of an old oak tree, lose some of their youthful flexibility. Our blood pressure learns to dance to a slower rhythm. The electrical signals in the heart, which once beat with a metronomic regularity, develop their own unique and seasoned cadence. A stress test, in its mechanical simplicity, does not understand this wisdom. It is a young man's tool, designed to find deviations from a young man's norm. It sees these natural, harmless changes of age and screams, "Problem." This is what the doctors call a false positive, a shadow on a screen that means nothing, but which changes everything. I remember a man from a nearby town, a retired bus driver named George, at 74. He was the picture of contentment. He had no chest pain, no shortness of breath, no fatigue that kept him from his daily walks or his time with his grandchildren. But at a routine checkup, his doctor suggested a stress test, just to be safe. George, being a responsible man, agreed. The test came back with a borderline result. That single, ambiguous finding was the first step on a path that led him far from the life he knew. It led to a cardiologist, then to an angiogram for a blockage that had never caused him a moment's trouble. A stent was placed, and then came the complications: an infection at the catheter site, a long stay in the hospital, and months of grueling rehabilitation that stole his energy and his independence. His quality of life never fully returned, all from a test he did not need, for a problem that was not a problem until it was found. This story of George brings us to a deeper, more subtle affliction of our modern world, the tyranny of the perfect number. We have become a culture that worships at the altar of data. We are taught to chase a perfect blood pressure reading, a perfect cholesterol level, a perfect blood sugar number, a perfectly clean scan. We have been convinced that health is not a feeling, not a state of being, but a number on a chart. And if our number is not perfect, we are filled with a sense of failure and a deep, gnawing anxiety. This pursuit is one of the great sources of our disease. It is a trap for the soul, because it convinces us to wage war on our own bodies in the name of a statistical norm that may have nothing to do with our actual well-being. Life, in its profound wisdom, is not a number. It is a flowing, changing, adaptable river. Health is not a static point on a graph. It is the ability of the river to navigate the terrain of our years. To be healthy is to be resilient, to be in harmony with oneself. The numbers we get from a lab report are merely a snapshot of one single drop of water at one particular second in time. That snapshot tells you nothing of the river's power, its history, or its destination. I once spoke with a woman, Eleanor, who was 80 years old. She was taking 7 different medications. When I asked her why, she explained that one was for her blood pressure, which was a little high. Another was for her cholesterol, which was also a little high. A third was a blood thinner, because of a slight irregularity in her heartbeat. The other 4 were to manage the side effects of the first 3. I asked her, "Eleanor, before you started all these, how did you feel?" She paused, and her eyes welled up. "I felt fine," she said softly. "I could work in my garden all day. Now, I'm dizzy half the morning, and I don't have the energy to pull the weeds." Eleanor's quality of life had been sacrificed for the sake of achieving good numbers. Her doctor was treating her chart, not her. The real question was not whether her blood pressure was 145 instead of 130. The real question was, could she live the life she wanted to live? The medications, while making her numbers better, had made her life worse. This is the fallacy of the perfect number. We must have the courage to ask a different set of questions. Does this treatment, this test, this number serve my life? Does it bring me peace? Does it allow me to do the things that bring me joy? Or does it steal my energy and fill me with fear in our later years? Our goal should not be to have the lab results of a 30-year-old, but to have the peace of mind of a sage. Let us speak of another ritual, another journey we are told we must take, the colonoscopy. For decades, it has been held up as the gold standard, the wisest path to preventing a terrible disease. And for many people, at a certain stage of life, it is a true lifesaver. But as the seasons of our life turn, the nature of wisdom changes. What was once protective can become perilous. After 70, and certainly after 75, we must look at this procedure with new eyes and ask if the journey is still worth the potential cost. The procedure itself is no small undertaking. It begins with what is called the bowel prep, a name that sounds clean and simple, but the experience is often violent and depleting. For an older body, this process of purging the system can lead to severe dehydration and a dangerous imbalance of the electrolytes that govern our heart and our mind. Many an elder has fallen in the night, dizzy and weakened, during this preparation. Then comes the procedure itself, which requires sedation. Anesthesia is a powerful force, and an older body receives it differently. The liver and kidneys, which have served us faithfully for so many decades, clear these substances more slowly. The brain becomes more sensitive. The result can be a lingering confusion, a brain fog, or memory issues that can last for weeks, stealing our clarity and confidence. But perhaps the most profound risk is one that is rarely discussed. It is the risk of finding something that does not matter. The polyps that a colonoscopy seeks are often incredibly slow-growing. It can take 10, 15, even 20 years for a small polyp to become a dangerous cancer. Now, I ask you to sit with that number for a moment. If you are 78 years old, a polyp found today may not become a threat until you are 93 or 98. Yet, the moment it is found, it creates fear. That fear sets in motion a cascade of events, biopsies, repeat scopes, and sometimes even major surgery to remove a piece of the bowel wall for an abnormality that might have slumbered harmlessly for the rest of a person's natural life. I think of a friend, an 82-year-old man named George, who was sharp and active. He was persuaded to have a routine colonoscopy. He became dehydrated during the prep, and after the procedure, he was groggy and fell at home, fracturing his hip. That one test, which found nothing, led to a cascade of real, immediate harm, surgery, months of rehab, and a permanent loss of his cherished independence. When we are young, it makes sense to look far down the road, but in our later years, the map changes. The most important question is not what could happen in 15 years, but what is the risk to my life, my strength, and my peace of mind today? We must not sacrifice the quality of our present for a marginal benefit in a distant, uncertain future. So, if we are to be more discerning about the tests and numbers that come from outside of us, where do we turn for guidance? The answer, my friends, is that we turn inward. We learn to read the book of our own body. This is perhaps the greatest, most underutilized skill in our later years. For decades, we have been taught to trust the machine, the lab report, the expert in the white coat. We have been taught that the body is a mysterious object that can only be understood by others. This is untrue. Your body has been speaking to you since the day you were born. The problem is, we have forgotten how to listen. Think of it. You have lived in this body for 50, 60, 70 years or more. You know its history. You know its patterns, its creaks, its whispers, its sighs. You know the difference between the fleeting ache of a damp morning and a new, persistent pain that has a different character. You know the difference between simple tiredness at the end of a good day and a profound, unexplained fatigue that saps your very life force. This deep, intuitive knowledge is more valuable than any single MRI or blood test. The great wisdom Traditions have always understood this. They teach that the body is not our enemy. It is our wisest counselor, if we can only quiet the mind enough to hear its counsel. This is not a call for neglect. It is a call for a more profound kind of vigilance. It is the difference between anxiously polling every stranger for their opinion and listening quietly to the wisdom of a trusted friend. Your body is that trusted friend. Symptom-based care is the name the doctors give it, but I call it respectful listening. If your body is giving you clear signs that something is wrong, unexplained weight loss, persistent pain that does not resolve, a shortness of breath where there was none before, a change in your fundamental functions, then of course, you listen, you take that clear signal and you seek help. That is using the tools of modern medicine wisely, as a targeted response to a real communication from your body. The folly is to go looking for trouble when your body is silent. I knew a woman who was a weaver. She said that after years at the loom, she could tell the tension of every thread just by the feel of the shuttle in her hand. She didn't need a machine to measure it. We must become weavers of our own health. We must learn to feel the tension in the threads of our own being. This requires practice. It requires moments of stillness each day. Instead of turning on the television, sit in a chair for 5 minutes and simply notice. How does your body feel? Where is there ease? Where is there tension? Do not judge it, just notice. This is how you begin to reread the book you have been carrying your whole life. You will find it is the most accurate text on your health that has ever been written. There is a modern invention that perfectly illustrates this conflict between inner wisdom and outside noise, the full body scan. It is a seductive idea, is it not? The promise of a machine that can look through you, from head to toe, and find any problem before it has a chance to grow. It sounds like the ultimate form of proactive, responsible healthcare. But in practice, for a person in their later years, it is often a curse. It is the exact opposite of listening to the wisdom of your body. It is the equivalent of walking into a quiet, peaceful library and having someone blast a fire hose of random information at you, then asking you to make sense of it all. These machines, the CT scanners, the MRIs, are incredibly powerful. They are designed to see everything, and that is precisely the problem. They see everything. An aging body is a landscape rich with history. It has bumps, shadows, nodules, and tiny lesions, the vast majority of which are completely harmless, like old stones covered in moss in a forest. They are what doctors call incidentalomas, or incidental findings. They are abnormalities that would have lived and died with you, never causing a single symptom or problem. But the skin cannot tell the difference between a harmless mossy stone and the beginning of a landslide. It just sees a shadow. And the word lesion or nodule or abnormality is enough to ignite a firestorm of fear. That fear is the beginning of a journey you never wanted to take. It leads to a merry-go-round of follow-up appointments, specialists, and invasive biopsies. A biopsy on a 45-year-old might be a simple procedure, but a needle biopsy on the lung or kidney of a 78-year-old carries much greater risks: the risk of a collapsed lung, of bleeding, of a serious infection. I read of a woman named Betty, 78 and vibrant, who was offered a discounted full-body scan at a health fair. She felt wonderful, walked every day, and had no complaints. The skin found a tiny lesion on her kidney. Panic set in. Within a month, she was in surgery to have it removed. The surgery itself led to complications, a long recovery, and a permanent drop in her energy. She survived the surgery, but her vibrant quality of life did not. She was harmed not by a disease, but by the discovery of something that may have never become one. This is what is medically known as overdiagnosis, the diagnosis of a disease that will never cause symptoms or death. And the emotional toll is immense. It forces you to spend your precious energy worrying about what might be, instead of enjoying the health you actually have. A full-body scan in an asymptomatic person is not buying peace of mind. It is buying a ticket to a world of anxiety. It is an invitation for the medical system to start chasing shadows inside you, often with real, physical consequences. True responsibility in this chapter of life is having the wisdom to trust the peace within your body and not go looking for a war that doesn't exist. So, how do we hold all of this? How do we navigate a world that tells us to constantly test and scan and measure while our inner wisdom calls for a gentler path? I would like to leave you with a final thought, a metaphor that has brought me great peace. Think of your body not as a machine, but as an old and cherished garden. In the spring of our lives, the garden is bursting with explosive growth. It is vigorous, resilient, and everything is new. We can be aggressive with it. We can till the soil deeply, plant ambitious crops, and it will bounce back from any mistake. In the summer, it is productive, strong, and at its peak. But as we enter the autumn of our years, the garden changes. It is no less beautiful, but its beauty is different. The colors are deeper, richer, the growth is slower, more deliberate. An wise gardener of an autumn garden does not behave as they did in the spring. They do not dump harsh fertilizers on the soil to try and force new growth that is out of season. They do not aggressively rip out every plant that has a brown leaf or a bent stem. To do so would be to violate the very nature of autumn. Instead, the wise gardener becomes a steward. They tend, they nurture, they protect, they gently prune away what is truly dead to make way for the remaining life. They enrich the soil with soft compost, not harsh chemicals. They appreciate the unique, quiet beauty of this season for what it is: the aggressive testing, the chasing of perfect numbers, the cascade of procedures for harmless findings. This is like treating an autumn garden with the violent tools of spring. It is a fundamental misunderstanding of the season. It does more harm than good. Our goal in our later years is not to have the body of a 25-year-old. Our goal is to tend to the garden of our 75-year-old body with love, respect, and wisdom. This means providing it with good nourishment through whole foods. It means giving it gentle movement through walking and stretching. It means making sure it gets sunlight and fresh air. And most importantly, it means protecting it from unnecessary trauma. Declining a risky test that has marginal benefit is not neglect. It is an act of profound stewardship. It is the wise gardener choosing to protect the delicate harmony of the whole garden rather than waging a violent war on a single discolored leaf. It is honoring the season you are in and finding the deep, quiet joy that resides there. That, my friends, is the truest form of health.